Hello, my name is Dr. Nate Samuelson from Vallejo Health and Wellness Center, and I thank you for electing to receive this free video on acid reflux, heartburn, and indigestion. Now, for many of you, I do not have to describe the symptoms that you're feeling. The heartburn, or the inability to digest food, or the waking up at night because you've got this burning sensation in your chest that just won't go away, or the burning sensation following eating like greasy foods. But those of you who don't know if you have this, but you're wondering, so heartburn is that burning sensation that sits near where your heart is. Regurgitation is that almost feeling like you're vomiting up into your throat, or you feel that acid kind of bubbling up into your throat. Vomiting, burping, difficulty swallowing, and then nausea. Now, what is acid reflux? Well, medically, acid reflux is where the stomach acid backs up into your esophagus, so the part where the food descends down into your stomach, so that's your throat. If this occurs more than twice a week, you have a likely diagnosis of GERD, so this gastroesophageal reflux disease. So what's typically done for acid reflux? Well, antacids, so that's your Tums and your Maaloxes, which neutralize stomach acid, but then you've got your H2 blockers, which also decrease stomach acid production, so that's your Pepcids and your Tegament and your Zantacs. But then you've got proton pump inhibitors. Now that's your Prilosec, your Prevacid, your Protonics, and your Nexiums. Those also reduce the amount of acid that your stomach makes. So that would seem like the right thing to do, right? If you've got way too much stomach acid, obviously you want to reduce it because, first of all, you don't want to feel that. Number two, you don't want to get an ulcer where you see that acid bubbling up into your stomach, right? So the problem lies in this. If you reduce the amount of stomach acid in your stomach, you can really effectively inactivate the enzymes needed to break down protein, which will lead to malnutrition and malabsorption conditions. All right. I want you to ask this question. If you stop taking your medication, let's say like your Prilosec, do the symptoms return? Why? I really want you to think about that. Why are your symptoms returning? Isn't this taking care of the problem? Or is it just taking care of the symptoms? It's because you have too little stomach acid. Probably asking exactly what this guy's asking. You're kidding, right? There's no way I've got too little stomach acid. I feel it bubbling up into my chest. Bear with me here. The vast majority of people who come into this office actually have too little stomach acid. It's the reason why going off the medication doesn't work. So this is your stomach, and your acid is typically formed right up here at the top. So food descends down and drops down into here. But the problem is that, remember how we had all that stomach acid way up to the top here, right? If we were to drop food into a low amount of stomach acid, that water level is going to rise. We learned this in basic sciences when we were kids, that if you have a vial of water or a cup of water, or even you sit in a bathtub, the water level is going to rise. In fact, just the other day, I saw this when I was at a hotel, and there was a whole family that was sitting in the hot tub, gauging how far up the water would go when everyone sat in that hot tub. So if you have food that's not digesting, that stomach acid level is going to rise. It's going to make it appear like there's too much stomach acid. But it's really too little. So low stomach acid fails to break down food quickly or effectively. The feeling that you are sensing, that you feel is too much stomach acid, is actually rotting and rancid food pushing up against your esophageal sphincter. So the throat, it's pushing up against your throat. Why does the body stop producing enough stomach acid? Well, that's a really good question. Really good question. Inflammation. Something has turned off the ability of the stomach to make proper amounts of stomach acid. So inflammation causes the stomach to produce less gastric acid, that's your primary acid in your stomach, enzymes which break down your foods, and mucus, which protects your stomach. The most common causes are diet, medication use, and infections. So how do we find which one of these is your problem? We have to do a thorough examination. We have to look to see if there's proper neurological influence coming from your brain to your stomach. We have to see if the stomach is actually the problem, or if it's something else. And we do that through muscle testing, blood, urine, and saliva testing to find out what's driving this inflammation. These are the ways that we address your condition. Adjustments to get things firing so you get the proper signals to your digestive tract. Brain-based therapies to, again, fire up the pathway from the brain to your stomach. Oxygen helps the body heal quicker, and supplements and dietary modifications. So together we can achieve this healing to get to the root cause of your acid reflux, your inability to digest food. Now, before I end this, I really want you to understand what inflammation is. So think of inflammation as swelling of an ankle. So you all have probably sprained your ankle before, right? You get a big giant mass of water or fluid that builds up around the ankle while it's trying to heal. If you eat foods that you're not supposed to, like grains and gluten or dairy, and you have a sensitivity to them, you're going to create swelling in your stomach. You're going to create swelling in your digestive tract. When that happens, it slows the body's ability to make gastric acid, enzymes, and mucus. And this is the reason why you have the inability to digest your food. Your small intestine does not want your food, so that's your intestine is right below the stomach. It doesn't want your food if it's not broken down, so it's going to sit in there as long as it's necessary for that food to be broken down. And that's going to be the reason why you have your acid reflux. And that's the reason why, while it feels great to be on your medication because you're reducing the acid going up to the top, but that's the reason why when you go off of it, you don't feel any better. So I like the quote by this pretty smart guy right here. Don't do the same thing as everyone else, taking the Prevacid, the Prilosec, the Tums, the Malaxes, and do that for the rest of your life. And expect to feel better for the rest of your life. Because doing the same thing over and over and over again, expecting a different result, is the definition of insanity. So get to the root cause of your acid reflux. Find out if your stomach really is deficient in stomach acid. Call our office today and set up an appointment. Change your life. Call 952-949-0676. It was a pleasure talking to you today, and I look forward to interacting with you soon. I look forward to seeing you in our office one day. Have a great day.